Many of our patients are suffering from cancer, and we're their lifeline, we're their connection to their doctor's office, we're their connection to their treatment. And they need that person there that can be the advocate to make sure they're getting the most out of their treatment that they can. And then dependable, because at the same time, they need to know that when they need their medication, they will get it. They need to know that when they have a question about their medication, there's someone at the other end of that phone that they can call, or at the other end of that counter that they can come in and talk to really solve whatever issues that they are facing. We're getting a whole suite of training that was designed in conjunction with the Leukemia and Lymphoma Society about blood cancers. And then we're going solid tumor type by solid tumor type and getting really in-depth training on each of those tumor types as well, so that we're very prepared to help the providers and the patients when we step into that pharmacy. Walgreens has industry-leading access to limited distribution drugs in oncology to make sure that when you need a therapy, we can provide it for your patient. In the rare case where we don't have access to the medication, we will be sure to get that medication to the right place right away and let you know what the status is of that prescription. We have so many tools at our disposal for this that finances should never stand in the way of a patient getting their treatment. So we work with the patient to get their copay as low as possible, whether that's through manufacturer copay cards if they're a commercial patient. If they have government-funded insurance where they're not eligible for those programs, we'll look into foundations. And there are many different foundations available to support patients suffering from different types of cancer. We really do everything we can to make sure financial hardship never stands in the way of a patient getting their medication. We also work directly with the doctor's offices, so if you're doing any sort of concurrent therapies, whether it be radiation and oral chemo or immunotherapy with a targeted oral drug, we make sure that the patients are getting the medications on time when they're supposed to, so that there doesn't have to be any delay in treatment or rescheduling of appointments, but also that they're not getting the medication way before they need it and start taking it before it's time to start taking it. What Walgreens has to offer is an industry-leading turnaround time of 48 hours or often even sooner than that, so that the medication can get to the patient right away and then that we can minimize that anxiety level for them. I find out why are they here, what medication they're going to be taking. Oftentimes we'll have received some medical information about their history from the doctor's office, and we'll use that to help guide our conversation with them so that they're well educated and that they can be confident in the plan that they have for the treatment of their cancer. Oral treatments can have just as bad side effects as IV treatments, so making sure the patient understands what they can expect from the treatment and how to prevent those side effects when they're preventable, how to treat those side effects at home when they can, and when it's important to contact the doctor's office to prevent anything from becoming an emergency, I think is a key role that we play in the patient's education. And then as their advocate for if they do experience something, it's very easy for me, being inside the health system, to go walk across the hall and see their doctor. We have a program set up for each individual medication tailored to how patients normally do on that medication. So of course we'll call the patient or speak to the patient when they come in for their first fill of the medication. We'll go through extensive counseling at that time. Then within a week or two, we're going to call to follow up with that patient, trying to address any concerns that the patient is having at that time. And then we'll follow up again at the end of their first cycle. After that, we normally follow up monthly, but for some medications that require extra monitoring or have different side effect profiles where the side effects might be delayed, we'll follow up at periods appropriate for that medication. We really get to know our patients. We really get to know our providers. Most of my providers have my cell phone number, so I'm very easy for them to access. And the patients know when they call, they can always speak to Alex, or they can always speak to the technician that they've come to know well. And it's really reassuring for the patients and the providers to have that team of people that they know personally and can depend upon. One of the many advantages of being on site at the health system in an oncology-specialized pharmacy is that I really get to know both the patients that come into my pharmacy and that we're dispensing medication for, but also the providers. It really becomes like an extended family where we're all here to advocate for the patient and make sure that the patient, from a pharmacy perspective, is getting their treatment on time, is doing well, managing any side effects that we can help them manage. and making sure that line of communication is always open between all three parties to ensure that the best possible outcome for the patient. One of the greatest things that we can offer is our communication back and forth. So through the whole process, from when we receive that referral from your office, we will be keeping you informed of any insurance authorization requirements. We also have a great suite of adherence tools. We have our Walgreens app that helps patients track their doses, and they can have dose reminders on their phone. And we, as their pharmacist, check on their adherence every month as we're calling them to make sure that they are continuing to take their medication, that they get their refills on time, and any barriers that they might have that we're addressing so that nothing needs to stand in the way of getting their treatment. Because our pharmacies are all connected in one network, and we're able to dispense all the patients' medications, both their specialty cancer medications and their normal everyday medications to treat their concomitant conditions, we can ensure every time that patient starts a new prescription or comes in to be counseled about an over-the-counter medication, that that medication is appropriate for the patient and won't interact with their other medications or their cancer treatment. Feel More Like You is a program that we built from the ground up to combine our expertise both in oncology and pharmacy more generally and in beauty. So we've taken our beauty consultants and our pharmacists in thousands of our Walgreens locations across the country and provide them with extensive training specific to how to help cancer patients manage both what's going on inside their bodies and outside their bodies. And what's really unique about this program is it's the only program in the nation that is really combining the expertise of both pharmacists and beauty to provide this resource to the patients. When patients look good and they feel good about how they look on the outside, it often helps them feel empowered and to feel better about everything else that's going on with their treatment. For younger patients facing a cancer diagnosis, fertility is often a major concern. At Walgreens Specialty Pharmacy, we have fertility-specialized pharmacies that can join in with our oncology-specialized pharmacies to assist these patients in obtaining access to fertility treatments and resources to make sure that this does not have to be an obstacle to their treatment.